Good morning. My name is Navina, and today I'll be asking you a few questions regarding your health conditions. And just to let you know, whatever that we discuss here is confidential, so please feel free to openly tell me like all your concerns, and we'll try our best to help you. May I know your name and also your age?
Okay, I'm Sarah. I'm 27 years old.
Okay, Miss Sarah, what makes you to come to the hospital today?
For the past 3 days, I feel it's very hard to breathe. I cannot take deep breath at all. It happened 3 days ago. That time I was cooking, and then I burned something. I was frying fish, and then I burned it. There was heavy smoke coming out. Since then, my breathing has been difficult.
So you've been having shortness of breath for 3 days.
Yeah.
When you had this, was the shortness of breath continuous after that, or did it stop?
It was continuous
It was
until
continuous.
now. Until now.
Did you have to use any medication?
I have tried taking my inhaler. I have asthma. I was diagnosed long ago. So I have been trying to take my inhaler, but it's not working.
It isn't working. Do you remember how many puffs you tried that time?
Almost 8 puffs already.
Almost
It's not
8 and it
working
wasn't.
until
I
now.
see.
Yeah,
Okay.
the first day I tried, second day I tried. Now this morning before coming also I tried, not working.
I see. Any other symptoms like wheezing during that time?
Got sound.
Got sound. And did you had like cough also?
Got coughing. Okay, I was coughing very badly on the first day because of the smoke, so it was irritating. I was coughing for almost half an hour, then I start to have phlegm. So the phlegm was also, it was so much, it was yellow and it was slimy.
So it was like kind of thick.
Kind of thick lah.
Okay.
So it continued for another half an hour to 1 hour, and then later I cough again until at one point there is no more sputum anymore, and it was also coming out from the nose, almost same color also.
Was there any bleeding?
No bleeding at all.
How about did you have any chest pain?
Got.
Cough?
Whenever I start coughing and whenever I try to take deep breath also, there is a kind of pain. It's not the sharp pain when I exercise. It's different.
It's like more tighter.
It's tight and especially happen when I try to take deep breath.
But the pain did not radiate anywhere. It's just more on the center. If I give you like a scale where 1 is very less painful and 10 is the most painful, where would you say this tightness feels like?
Not too bad lah. Uncomfortable 3 or 4.
So it's still bearable lah. Okay. Any fever during this period?
Got 5 days ago got.
Oh, so you had fever before this shortness of breath?
Yeah, and at that time also I tried taking Panadol, but it was not going away. Okay, Panadol works how long? 3-4 hours. Okay, it was gone for that time. Then it happened again. It was not going away.
Okay, so you had like fever and then wheezing associated with the chest pain. No, so you tried using your inhaler and it didn't really help much lah. Okay. So did you have to admit for this?
Many years ago. Now I'm 27. 9 years ago when I was 18, that was the first time, and that was when I was diagnosed with asthma also.
Okay.
So that's why I got the inhaler. 18 years ago I was warded in ICU, and then they gave me the mask. They gave me the
Is
mask.
Oxygen mask?
Yes.
Okay.
Gave me the mask. I was discharged after 3 or 4 days. After 3 or 4 days, and then they gave me the pink inhaler. I had to use every day, but then I stopped already after one time. And then after I finished that medicine, then I never went to the hospital back. I only buy the blue one just in case I need.
So this was only one time where you had like a severe attack and you had to sign. What was the most recent attack before this attack right now?
Most recent, I think it was 2 weeks ago. That time we were actually cleaning around the house, so it was quite dusty. And so that time I also had very bad cough, but after using the inhaler it was fine. Actually, few days ago also I was using my inhaler in office and it was fine in the morning, but then now it's not working anymore. And I noticed also when I have when my asthma attack generally happens in the morning, and then it will happen especially on a cold day or when I'm drinking cold drinks. Then one time after fever also.
After
Several
fever.
years ago, yeah.
So like you're saying like fever and then cold environments and also like dusty places, it causes you to have that difficulties in breathing.
Yes.
So when the recent admission, do you remember like what could be the cause of it?
Recent admission. Oh, my most recent admission was also like 3 years ago. That time it was because of fever lah. I
Because
was
of fever.
also having fever like this, and then but that time it was even worse. So I had to be warded for
For a
several
few
days.
days. I see. Okay. Do you apart from the symptoms that you've told me, do you have any other symptoms like any nausea,
No,
vomiting, abdominal pain?
No.
So no any changes in your urinary or
No.
bowel?
No.
Okay. So from what you say, I think you are aware that you are having asthma and you kind of know about it. Anything that is a bit more concerning for you right now?
Oh, I'm concerned because now 3 days I thought it was going to be better, so I submitted for leave. But then if this continues, then how long do I have to leave the office? I mean I'll leave work because I work as a kindergarten teacher. I cannot leave for too long. Then it's also really painful to because I cannot breathe. And then suddenly, usually my medication works, but why this time it won't work?
Oh, so your concern is like about the medication and all. You said you have this shortness of breath. Does this happen when you lie flat, like when you're sleeping?
Yeah. It's quite hard to sleep with one pillow also nowadays. For the past 3 days, so I use 2 pillows to
Two
sleep at
pillows
night.
at any like sudden awakenings due
No,
to
no,
this
no.
shortness? No. Okay. And so like you got diagnosed at the age of 18, asthma. Anyone in the family who also has asthma?
Yes, my mom, my brother. My mom, my brother also since almost my age.
Are they also using their inhalers
Yes.
frequently? Are they
No, frequently means every day in the morning, yes.
every day in the morning? Do you think their asthma triggers are also similar as
Yes,
you?
yes.
Also similar. Okay. Do you have like any changes in your lifestyle due to this asthma, like difficulties in carrying out any activities?
Since then, especially going up the stairs is difficult.
Going up the stairs. So usually, do you know how many stairs that you can take at least before the attack starts?
One or 1.5 floor at max.
And when these attacks happen, do you need like your inhaler or it's relieved by rest?
Generally relieved by rest.
Generally relieved by rest. Okay. And besides this asthma, do you have any other medical conditions?
Not that I know of, just that recently in the early of this year, several months ago, January, February, I noticed that I have been having a hard time losing weight. Then my period also sometimes coming after 3 months, after 6 months. It's irregular and it's rare for my period to come. So, and I've been having this facial hair also, my neck is also a bit dark. So I've been reading about PCOS and also I came to see doctor. Oh, it was indeed PCOS. So doctor also prescribed me with a medication. I don't remember the
Is
name.
it Diane?
Yes, it is Diane. So I've been taking every morning as well.
Every morning once.
Yeah, once every morning.
And this follow-up is at which hospital?
HISAS.
At HISAS.
Yes.
Your asthma, is it also at HISAS?
Yes.
Okay. Anyone in the family who also has because
No.
Okay. Anyone in the family who has like any chronic illnesses like hypertension, diabetes, or cholesterol?
No.
Not really. How about you, Miss? Do you have any of these illnesses?
No.
Do you have any allergies to any drugs or food?
Medication, I am not sure. I don't think so. But I did have once when I was really young. I think I'm allergic to seafood because when I consumed seafood at that time, I still remember there were rashes all over my body. It was really itchy, and then it was getting hard to breathe as well. My throat and my tongue became so swollen I couldn't speak and it was hard to breathe. And since then I never consumed.
For these rashes, did you have to take any medication?
Yeah, I took antihistamine.
Antihistamine, and it immediately resolves. No any steroids taken.
No.
Okay. Can I know actually like when did you got your last period?
Quite recent. My period it's been a long time actually. I think 3 months ago.
3 months ago. And you got, like, at what age when you got your first period?
12 years old.
12 years old. Okay. And ever that time, was it regular?
No,
Not
since
really.
beginning also it
It
was.
was a bit like irregular.
Yeah.
I see. Any pain when you have period time?
No.
No. Okay. Can I know if you're married?
Yes.
You're married with how many children?
No, I don't have any
No
child yet.
children. I see. How about your working environment? Would you like to explain more on that?
My working environment is fine, hectic, and there are many kids nowadays. Especially some kids have, because they are kids, they tend to gather
Are you a
together.
school teacher?
Yes, I'm a kindergarten
kindergarten.
teacher.
Okay.
So some of these kids recently, because of the weather changes, I think, so they have been reported sick as well. Some of them have been coughing, they have been having fever. But otherwise, it's fine. It's an 8 to 5 job.
I see. Any cats at home? Any pets?
I do have one, but it's staying outside the house, rarely coming inside the house.
Oh, so you would say like there's less animal fur in your
Not
house?
much,
Not much. Okay. So I've asked the questions that I needed to ask. Is there anything that you expect from us from this consultation?
I would like to know how to improve my condition first thing first. Second, I would like to know why my medication is not working anymore this time. Thirdly, I would like for this to resolve as soon as possible so I can get back to work. There is so many things pending and it's beginning to concern my family as well.
Okay. Thank you so much, Miss Sarah, for sharing me like your concern. So from what I see, it looks like you are having like a very poorly controlled asthma, since you mentioned like your inhaler isn't working as well and you do get more frequent attacks this time. We will do some examinations to check the severity of the asthma, and also we'll conduct any appropriate investigations to really find out if you have any new triggers, and we'll also like try to see what are the best treatments that we can do to help you. Okay, so we'll proceed with the investigations. Okay, Miss, so now I'll be taking your blood pressure reading. Is it okay if you could like open your sleeve up? Okay, so have you had your breakfast?
Yes.
And did you drive over here?
Yeah.
You had good sleep last night?
Yes.
So you just relax your hands over here. So today we'll do a physical examination, and during this physical examination, ideally I should expose you all along your chest, but for this video we'll just see how it is. Okay. So do you have any pain or anything before we start? Nothing. Okay. So upon general examination, the patient is alert and conscious. She is not in any pain or respiratory distress. There is no any sputum cord around her or no any walking aid. She is not pale or sanus. Can I see your hands? Now can you do your hands like this? Like this? Bring them closer. Okay. Okay, then relax. So upon hand examination, there is no any finger clubbing noted, no any peripheral cyanosis or task staining. The capillary refill time is less than 2 seconds. Both hands are warm and moist. They are not pale. Now can you put your hands straight? Up, please. Okay, there is no any fine tremors noted. Okay, you can relax your hands. The respiratory rate is 12 breaths per minute. Do you have any pain? No pain. How about here? Okay, there's no any signs of scleroderma or rheumatoid arthritis. Now I will open your shirt a bit. No, there's no any bruises noted on the arm. There is a BCG scar on the left side of the arm. Okay, now can you look up please? I will. Okay, look down. Now can you say R for me? Raise your thumb. Okay. So upon eye examination, there is no any scleral jaundice or conjunctival pallor. And upon mouth examination, there is no central cyanosis and also the oral hygiene is in good health. Now I will be touching on your neck a little bit. This may be a bit uncomfortable, but it's to check for any complication. So is it okay if you move your tudung a bit? So there is no tracheal deviation noted for this patient. Now I will proceed with the chest examination. Okay. Before that, the patient has to be in a 45-degree position. Okay, upon delivery, so upon chest examination, there is no any chest deformities or any chest scars noted, no any lobectomy scars noted as well. Sekarang I'll be palpating the chest. Can you breathe in? Breathe out? Breathe in? Breathe out. In, breathe in. Breathe out. Breathe in. Breathe out. Last one. Breathe in. Breathe out. Breathe in. Breathe out. The chest expansion is equal bilaterally. Now, once I place my hand on your chest, please say 99.
99, 99, 99.
So the tactile parameters is normal. The percussion is also normal along all lobes. Now I will need you to breathe in and out through your mouth. Breathe in. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe in. Breathe in. Vesicular breath sounds are heard, but there's also occasional bronchi heard, more on the lower parts of both lobes, but there's no any added sounds heard in the lung. Now miss, when I put my stethoscope, please say 99.
99, 99, 99, 99, 99, 99.
So vocal resonance is also normal. Now I'll just press on your legs a bit. Is there any pain? So there's no any pitting edema on the leg. So to complete my examination, I would also like, if there is a sputum port, I would also like to examine the sputum port. Okay, thank you miss for your cooperation today. Okay, na? So yes, Miss Sarah, now after doing the examination, now we are going to do a few investigations to further check your case. So first I will do a full blood count first. I would like to confirm if there's any source of infection through your white blood count, and I would also see on something that is called your eosinophil, which is to check your severity of your allergic reaction. And then I would do a lung function test to see how severe is your airway obstruction, and then through that we can know if it's confirmed asthma. And to confirm asthma, then we would also do this test called bronchodilator reversibility test, where we would give you an example of a bronchodilators, and we would see if there's any improvement in your lung function test based on the bronchodilators that is given. And also to assess your control of your asthma, we would advise you to do a peak expiratory flow rate every week in your home. This is just to check like if there's any improvement in your airway obstruction. So for the management, since like we may have to review on your inhaler that you're typically using, so then we would also see if like we would advise you to be more compliant to your inhaler, especially even the preventer inhaler that is given. So we would teach the proper inhaler techniques and also like tell you like how frequent you should use it. And also we would to identify if there's any new triggers to your condition, we would also do a skin prick test to see if you have any new triggers, and through that we would advise you to avoid those triggers to cause any severe attacks. Is there any questions you have for me right now?
So far, no.
So far, no. Okay. So I will later consult you with the treatment, and just want to thank you for this consultation today.
Thank you. Wow, so short.
2 minutes.